With summer right around the corner and COVID-19 restrictions easing across the country, many people are anxious to travel again. But how safe is it? We'll talk with health and travel industry experts about what passengers should be doing and what safety precautions airlines are taking. We'll also get an update on the state's safe travels guidelines for vaccinated and unvaccinated passengers. Tonight's live broadcast and live stream of Insights on PBS Hawaii start now.
Aloha, and welcome to Insights on PBS Hawaii. I'm Daryl Huff. Have vaccine, will travel. That's what many people are thinking, but it's not that simple. Depending on your destination, there may be rules in place for entry, like Hawaii's pre-travel testing program. And of course, who knows what the rules are for coming home. And despite the Centers for Disease Control saying it's safe for fully vaccinated people to travel, some folks may still be wary, especially when most of the world is not vaccinated. Our panel tonight will discuss staying safe from the virus and safe from regulations that could ruin your plans. We look forward to your participation in tonight's show. You can email, call, or tweet your questions, and you'll find a live stream of this program at pbshawaii.org and the PBS Hawaii Facebook page. Now to our guests. Lieutenant Governor Josh Green is the state's COVID-19 liaison. The father of two also works as an emergency room physician and survived COVID himself last year. Mike Victorino is in his first term as mayor of Maui County, which includes Maui, Molokai, Lanai, and Kaho'olawe. Before that, he served on the Maui County Council for 10 years. Mitch Roth was elected as Hawaii County mayor last November. Prior to that, he served as the county's prosecuting attorney since 2012. Peter Ingram is the president and CEO of Hawaiian Airlines. He first joined the company in 2005 and was named to his current position in 2018. And John DeFreitas is the product development manager for Panda Travel. The locally owned travel agency specializes in tour groups and is about to mark its 40th year in business. And I'll start with you, Mr. DeFreitas. You must have been wondering for a while if you'd ever get to 41 years. So tell me, what are the concerns that are being expressed by your customers in terms of getting ready to travel again?
Well, to be honest with you, the majority of the folks that we speak to, they want to travel. And we're finding that they're actually coming out and telling us they're vaxxed and they're ready. A lot of it is just waiting to see, especially internationally, when, what the direction on what's going to be. I mean, Asia obviously is a big area for us to travel to. And for now, we just don't know when that's going to open up. Domestically, people are, beginning to go off on their own. It's just a little difficult right now with tour groups. It's different than when you're doing individual travel. So individuals are going off mainland on their own and they're fine, but putting together groups and organizing that has been a little bit difficult until we have a better directive on with the future.
Do you have a Vegas business? Do you guys?
We do some. We do some. I mean, right now it's the local company like Vacations Hawaii. They've gotten back into it with Hawaiian and soon will be doing their charter back in the air again too. I mean, we're going to get involved with one of the football games in November, which actually is doing quite well.
Peter Ingram from Hawaiian Airlines, what are you hearing from customers of the airlines? Do you still get a lot of questions about whether planes are safe, airports are safe, and are people at any risk getting on an airplane and going through an airport? I've been through a couple of mainland airports recently, and it was just like business as usual.
Yeah, I think things have picked up an awful lot domestically. The good news for us is that air travel has been safe. We really haven't seen a lot of cases associated with air travel, even before vaccinations earlier in the pandemic. And a lot of that has to do with things that were in place before, like the circulation on our aircraft, where fresh air is introduced all the time, and anything that recirculates goes through HEPA filter. So it really is an indoor environment that is as safe as any to be for something like this. On top of that, we've had our mask mandate in place since early in the pandemic. That has earlier this year become a federal requirement. We've enhanced our cleaning procedures. We've changed protocols in the airport to install plexiglass and encourage distancing. So we're very comfortable that the environment is safe. What we're seeing from passengers right now is that they are ready to travel when places are open. Our domestic business between the mainland and Hawaii has recovered at this point in terms of passenger volumes almost fully, and by June and July it will be fully recovered. What we're waiting for is the international piece to come along, and we're still seeing some sluggishness in demand for travel between the islands.
Josh Green, what are you hearing about people's concerns about travel? I mean, do you feel like even despite CDC guidelines that are sort of trying to discourage it a little bit, do you feel like it's safe to travel?
I do. I feel it's totally safe to travel now. A large part of the country is vaccinated, and also the Safe Travels program added the extra layer of security by having that pre-test. I know that that's been onerous for people, and I just can't wait to, like everyone, not have to worry about such things. But we wanted to keep the counts down, and Hawaii was able to keep our rates at the lowest in the country. But I get calls every day from really sweet people that are heartsick because they just got the wrong test, or they didn't realize that the vaccine card that we're now using for travel interisland doesn't yet apply to travelers from the mainland that were vaccinated there. So there is still always some confusion, but this has been a labor of love, because in a pandemic we had to be as safe as we could and then also tried to salvage the economy. So that balance has been struck, but I am looking forward to it being just wide open travel.
You know, let me ask the two mayors that we have here. Both of you at one point or another had an additional test. I think right now Maui County is doing the additional test. For a while, Hawaii County was doing it. Mayor Roth, let me ask, why did you guys finally end up dropping that post-test program?
Well, we're actually ending that program on the 31st, so we haven't quite dropped it yet. What we're seeing is in our recent counts, the number of people that we've been catching at the airport with COVID has come way down. That being said, over the whole pandemic, we've caught quite a few people, over 100, and I think it's about 170 people altogether. That 170 could have turned into thousands and could have turned into a lot of lives lost. We've been very lucky. Part of it is because of the Safe Travels program. Part of it's the secondary testing. But I think the bigger part is what our community has done in taking really seriously this COVID outbreak. And so, our island has been pretty safe, and we've been able to get businesses back and moving. So,
Mayor Victorino, tell us how's it going with your testing program? Are you glad you set that up, and what did you learn from it?
Well, yes. Thank you for the question, Daryl. First of all, we have to date, as of yesterday, screened over 95,000 passengers. Maui, there have been days where Maui's visitor count is actually higher than Oahu, and we have recovered a lot quicker than we had anticipated. Our occupancy now is between 65 and 70%. And the good thing about it is we found, and we've done 71,000 tests, antigen tests. Of that 71,000, we found 25 positive cases. However, when we did a NAT or a PCR confirmatory, we only found 2 cases. Well, that's a percentage of 0.0003% of the number of tests that we have confirmed. What the test was all set up about was, first of all, the biggest thing I had heard over the months of January, February into March is the visitor bringing it in. It's the visitor. When we knew, and even our Department of Health was confirming that it was really the resident, it was community spread. So in April, we set up the program, started in May, and now confirmed that it really isn't the visitor, that it really is our community, that at times, and just like the last cluster in Molokai, one person knowingly was sick but felt, no big deal, then spread it to 35 others. Really helps.
Mayor, let me ask, so it's interesting you make that point, is that I wonder sometimes, and Lieutenant Governor Green, if you could weigh in on this as well, have there been times when testing programs were set up ultimately to allay the irrational fears of people about a certain risk? And has that been part of the process throughout this thing? Are what you're saying, Mayor Victorino, is that you essentially proved it's not the visitors, so now maybe the community can concentrate on itself?
Well, that's part of it. It was a real three-prong approach. First of all, was to really find out if, number one, the visitor or the returning resident were bringing it in. And of the two, one was a resident and one was a visitor. So that really, kind of lays that to rest. Secondly, we wanted to also, because of all the variants that are out there, the variant, especially now, if you read today's Maui News, it was saying that we are now have the highest percentage of the Brazilian variant that's coming in. So we want to make sure we're catching it, or at least we can figure if it's coming in from the outside or within the state, or returning residents who are being exempt because of their working exemptions. So that's some of the other areas that we wanted it. And the third thing for me was, is the vaccination process working? Is the program working? Well, I can honestly say, Josh, you and I agree, it is working.
You're talking
There's
about
no question about the vaccination.
Mary, you're
So it
talking
was
about
really not just to make sure that the numbers are low because we wanted to prove it was the community. We wanted the community to see that. And you're right, Daryl. Hopefully now they'll be more in tune. And our numbers have been single digits all these for almost a week now. So we have gotten down and where it's much more manageable. We haven't taxed our hospital or our medical facilities. We only have one COVID case in the hospital right now and one on ventilator. That's it.
Okay,
so
Mayor,
everything's in a good position.
I got your compatriots up here waving at me. Mayor Ross,
Okay,
you
yeah,
wanted
go
to,
ahead. I apologize.
It's okay. It's okay.
One of the things that we've done on the Big Island is we went to that secondary testing of only people who have not been vaccinated. And that was really telling as well, because we've had entire flights coming from California, for example, where everyone was vaccinated. It's interesting to see in our island, those numbers are much lower, but I think between 60 and 80% of the people coming in were already vaccinated. And that's something that was really interesting to find out.
Really quickly.
And that's interesting you say that, Mitch, because here in Maui, with the large numbers, and I know what percentage of, I know your numbers each and every day, which in an average month, we do in an average week, we're only at 28%. So it's very different here. We cannot compare apples with apples because we're all different. Okay. But that's always been my battle. But continue.
Okay. Josh, really briefly, what are the main things we've learned from testing of travelers?
Well, it was very important from the outset that we do that. When we did the surveillance program in the beginning and the testing, when we started to reopen the state in October, we had to do that and we had to have some data because there was a very serious problem. We hadn't had anyone in Hawaii for some time, for over 6 months when we shut down in March. And we were able to keep our cases very well settled. Had we had an explosion of cases after travelers came, there was going to be a very significant challenge to keep the peace. We couldn't afford for both the short term, we didn't want to see any conflicts, but the long term either. We did not want to develop an antagonism with people that travel here, that view Hawaii as, a part of their dream. And we, of course, depend on them to a large degree for our economy. So that had to be done. And then I always felt that it was good that the mayors at different times would do some additional testing. I didn't think that we needed to test all the time, but because the pandemic evolved, it's gone through several cycles, it was good to get samples. So all of this was a part of a larger public health initiative. It also did reassure people because each of the counties, like Mayor Victorino said, had different feelings at different times in this crisis. So I'm really glad to have seen these results.
John DeFreitas from Panda Travel, do you get a lot of people complaining to you about these pre-travel tests? Or do people feel like it's worth it to get to Hawaii? What kind of feedback do you get from clients?
Well, I think inbound people are, yes, people who are going over, they're going to the mainland and they don't have to do anything. And then when they come back, they have to take the time to make an appointment and get tested. So yeah, I think for the most part, if you're a local person, I think you understand living on an island, why we're doing it. But sometimes the folks from the mainland, because they've had that availability to travel between states for months now without that requirement, that they sometimes look at it like, why is Hawaii got to be so different?
Peter Ingram from Hawaiian Airlines, you're getting the first questions directly at you. So the question is from Hilo, Mr. Ingram, how will you improve customer correspondence concerning COVID guidelines and questions? And this is not specifically for Hawaiian Airlines, but generally speaking, why is the state making it so difficult to travel inter-island? If you don't have a computer or smartphone access, it's very problematic. That's Alan from Pearl City. Peter Ingram from Hawaiian Airlines. Has it been difficult to make sure everybody knows what's going on when they're flying? I had the experience of flying from Seattle fairly recently, and there was this long line, and everybody's going, "What's that line?" And then eventually they explained what the line was, and even once they were in line, people were like, they would go through the whole line, and then they would get bounced at the end because they didn't have some piece of paper, or they tried to use their smartphone. How difficult is it for an airline like yours with so much activity going to Hawaii to make sure people know what's going on, and how much of a stress has that been on your folks?
It has been challenging, and it's something we recognized we needed to do our best to do up front, and try and get information to our guests. Part of the reason it's been challenging is the rules have changed at different points. The testing providers initially were a very limited list. We actually worked to set up testing providers in all of our urgent points. That took a little while to get in place, but each one of those testing providers needs to be on an approved list from the state of Hawaii. Josh referred earlier to one of the real difficult challenges is we have people who have endeavored to do everything right, but got a test from the wrong place. And having them land in Hawaii and then be told that they either have to go into quarantine for 14 days or now 10 days, or they have to go back home is a pretty difficult message to deliver when they've just gone and got a test to prove that they are free from COVID. So that's been challenging. Having different rules on different islands has been challenging. It has gotten a little easier, I would say, as things have stabilized a little bit. And people, because they are really wanting to travel right now, have been incredibly tolerant, I think, of some of our rules changing and moving around. But I do think we have to keep a focus on delivering great hospitality to our visitors, and remembering that as we move into the future, we have competition for people wanting to travel other destinations, and this is an important part of our economy. And so we shouldn't lose sight of the Hawaiian hospitality that is a big part of the reason people want to travel to visit Hawaii in the first place.
Josh Green, this question about difficult to travel inter-island, I guess inter-county is the proper term, and the lack of smartphone access. And from what Peter Ingram just said, once you change rules, it takes a while for all the people to settle into understanding it. We're now heading in to a really big change once we start using these the vaccine cards. Can you give us a sense of what's ahead in terms of the vaccine cards? Inter-island, inter-county, it seems to be working, although we've heard about a lot of long lines and waits. And I imagine that's a concern, especially if you now open it up to local residents wanting to come home.
Yes, so lots to share here. First and foremost, it has worked very seamlessly. If you've been vaccinated fully and had 2 weeks to get your immunity in place, 14 days, you can just use your vaccine card to travel inter-island freely, inter-county freely. No need for quarantine. Over 25,000 people in the first 2 weeks did that, and it saved $2.5 million of tests. But the time will come to dump that all together. And at this point, with the viral load very low, we should get close to that. But more importantly, we're going to use the vaccination cards to reduce the need for all that pre-testing. First, we saw what we did for inter-county. Next, and it looks like June 15th is likely the date, though the governor will have to finalize this approval. If any of our people have been vaccinated fully in Hawaii and they go, say, to Vegas for a trip, or they go to the mainland for a trip, when they come home, if they've been fully vaccinated plus 2 weeks, they can again use their card the same way. It's quite seamless, and again, saves you that money. If you're a family of 4, you don't need 4 tests. Then finally, the third phase will be for anyone on the mainland to, if they've been fully vaccinated plus the 2 weeks, to be able to travel to Hawaii with their vaccination card. And we're targeting sometime in midsummer. I think it's going to come around July 7th, and that's optimistic, but I do think that's the time. The reason the governor has wanted to go a little bit slowly on this is, number one, we're very grateful that we haven't had a surge of COVID and the variants are on our minds. Two, we can verify if people have been vaccinated here through all of our great partners like Queens, Pacific Health, Kaiser, DOH. So it's a process. And then at the very end, once we've got herd immunity across the country and a lot of security with immunity here, we should probably talk about that at some point. Then we won't have to do any of the safe travels. It'll just be essentially back to normal. But last thing I'll say, and forgive me for going on so long, Daryl, is today we passed a major milestone. Today we passed the 50% mark, 50, half of all of our citizens in Hawaii are now have received their full vaccination. That's a big deal because immunity will begin to skyrocket and cases will drop precipitously.
Let me circle back for the neighbor island mayors with that question about the difficulty of traveling inter-island. I know at the very beginning of the pandemic, it was very difficult and very frustrating for people. And then there was, the quarantine requirements and so on, and they varied from island to island. Now there's some pre-travel, there's some testing and stuff required, but do you guys have concern about how difficult it's been to travel neighbor islands, and how do you feel? How are your constituents feeling about travel right now? Let's start with you, Mayor Roth from the Big Island.
We've had kind of a mixed bag. We've heard concerns from people about the long lines at the airport, but we've also heard people who are, really happy that we've been doing the secondary testing because our island has been pretty good. We've remained pretty safe on our island, and so we have kind of a mixed bag. When we were looking at dropping the secondary testing earlier in the month, I had people that were applauding me and criticizing me at the same time, and here we come up again to the 31st, and I expect to have the same. There's people that they're really worried and they appreciate the secondary testing, and then there's people that are just frustrated with the long lines, and especially whenever we do something new, and Peter kind of alluded to this, whenever we do something new, there's a learning curve, and it takes time to go through some of those things, and that delays things, and people don't like the delays. The other thing that's been really difficult for people is traveling to other islands to visit their family and friends, and it's not just $150 one way. A lot of times they're taking 2 tests, and so same thing for going to the mainland. They're spending a lot of money, and so I think the more we get people vaccinated, we go through this next phase where if you're vaccinated and you don't have to get another test, you don't have to get tested at all. I think people will appreciate that. And again, Josh kind of said it, Lieutenant Governor said it, we're seeing already that the numbers are coming down significantly. And as we vaccinate more and more people, the easier it's going to get. I don't think it gets harder from here. I think it gets a lot easier.
Mayor Victorino, the current state of mind of your constituents about neighbor island travel, and also it's an interesting point. Do you think being on the neighbor island and knowing if you got vaccinated, you could travel more easily, that must be a huge incentive to people on your island getting vaccinated?
You would think so, but unfortunately, vaccinations on many of the other islands, and including this county, have been sort of slowed down. People are more resistant. And Josh, you can attest to this, a lot of misinformation is being transmitted through social media and other means, or your friend tells you this. And so there's been a lot of resistance. I was with a lady today at Costco, not vaccinated, doesn't want to get vaccinated, totally afraid of vaccination, and gave me every reason in the world but anything logical, because we're passing out masks in Costco. And it was really difficult because you see that resistance. However, the incentives of travel, incentives that we can have big gatherings, or maybe even to enter a theater, maybe even to go to a concert, you'd have to have a vaccination. You see that all over the mainland, baseball, many sporting events, Broadway. So these are areas that I think those incentives, along with the logic that we are now seeing long haulers, the long-term effects, when you're not vaccinated, you're more susceptible to getting a bad case of COVID than if you are, and you recover quicker, and the long-term effects are lessened because you're vaccinated. So there's a number of things that we got to keep pressing along, keep educating people. But for Maui County, we've had inter-county travel between the three islands. And when there was an outbreak in Lanai, or like the latest outbreak in Molokai, there are those who will start saying, well, you should shut our island down, you don't let anybody in. Well, you know what? Biggest problem is you come here to Maui to do shopping, to do a lot of your commerce and business, and doctor visits are here. If I shut it down, that means you can't come and we can't send somebody to you. So there's been these real challenges when you're a three-island county, which none of the other counties have had that challenge. You know, if you live in Waianae and you go to Kaneohe, no big deal. You're sick, you're sick. Yeah. But here, because of the different islands, we have those travel challenges. That's why the inter-county is something that I pushed because it really was a different scenario for our county.
Yes, very much. Peter Ingram, a question that, and also John DeFreitas might want to take this one on too. Liz in Kaneohe asks, will people have a difficult time traveling on the mainland with the vaccination cards issued in Hawaii? I think that the broader question here is, what are we seeing on the mainland? Are there travel restrictions in some places? I'm not even familiar with whether you can be barred from a place on the mainland for any reason. What's out there right now in terms of people going to the mainland? Are there places where you have to go through some kind of screening or show a vaccination card or get tested?
There were some testing requirements in place earlier this year, late last year, when we had the spike in cases on the mainland in the December-January period. But by and large, those have all been removed. I've personally been to the mainland 3 times over the last 6 or 7 weeks, and there's no restrictions on travel in any of the places I've been in terms of landing there. So we are increasingly, as cases come down throughout the country, becoming the outlier again in terms of having a lot of restrictions in place for travel to Hawaii.
Do you not agree that those are a good idea?
I think there was a time and a place for a lot of the restrictions. I think, you know, we hear so much talk throughout the course of the pandemic about being science-based, and I think we should be, as we were being science-based about putting restrictions and testing protocols in place as cases were rising over the course of the pandemic. We should be science-based about removing them when risks are lower and not putting impediments into people going about their lives. And I think the mayors and the governor are thinking about that in terms of things like lifting restrictions on wearing face masks outside or having people able to watch kids play sports. I think we've got to take the same view towards travel, particularly as we have so many more people vaccinated.
John DeFreitas from Panda, the people that you send to the mainland, do they sometimes wonder, well, what am I going to run into over there? And how do they respond when you say there isn't?
I think now, as Peter was saying, they're really, I think outside of Hawaii, the mainland, people move around pretty freely and they're without restrictions. I think they've pretty much been lifted throughout the mainland.
For Lieutenant Governor Green and Greg and Kaka'ako asks, why are you so confident that future outbreaks won't happen due to travel that will cause another lockdown? And then another person says, rebuttal to Mayor Victorino. This is an anonymous person. If the virus didn't come from tourists, where did it come from? Lieutenant Governor Green, can you take both of those questions on?
Sure, yes. So a couple things. First of all, travel is very vibrant now. We had 26,031 individuals travel from the mainland yesterday. We normally only got to 30,000 on a given day, so it's really going well. Couple things. Well, to answer the question where they challenged the assertion that Mayor Victorino made, when we were having a small amount of travel, it was a lot of our own individuals. We had individuals that were working and had to come back and forth, bringing goods and so on. And so there, of course, was some virus because it's really infectious. This is long before there were any vaccinations. there was just going to be some virus that spread. We had no immunity to coronaviruses, as you know. So that was one thing. The other question: how do we know there won't be an outbreak? Well, there will be some cases, but they will be less and less and less. A couple things: we're third in the country right now, which is quite good, in the number of individuals that are adults who have been vaccinated at least once. So we're at 80% of all of our people over 18 have had at least one shot, and that provides incredible immunity. Even just one shot, though you should get both, gives you over 80% protection from the virus. So we won't have that widespread outbreak if there's some virus around. There will be cases, though. There will be clusters in places, especially rural parts of our state, where there's more reluctance to be vaccinated. Where I was the physician for several years on Big Island in Ka'u, the people are wonderful there, but they are a little less willing to get vaccinated en masse. Maybe only 60 or 65% of our community there will get vaccinated. That means there will be some small outbreaks. But the very good news is most of our kupuna have been vaccinated, and therefore there will be far fewer serious cases. It will not be perfect. We will have to watch that a variant doesn't break through, say one of the variants that causes severe disease. But for the most part, the vaccines have been really effective, and you can't stay locked up forever. So I totally echo what Peter was saying. We have to follow science and open up, and the time is coming quite quickly.
Mayor Roth, go ahead.
Yeah, too. And, what we're seeing on the Big Island is very similar. It's not so much the tourists, it's a lot of the people who are coming back that are bringing our COVID back. Our hotel industry, the hospitality industry, has been doing an amazing job screening, and we've had large events. We kind of stole the idea from Mayor Victorino and Maui on how to do that, make sure that they have safety protocols in place that allow us to do large events. We're not seeing the clusters coming out of there. We're not seeing cases come out of there. We figured out that it's about 90% of our local people versus 10% of our visitors who are bringing in the COVID. A lot of people who travel, unfortunately, don't wish to get vaccinated. Not everybody, the majority, of course, do get vaccinated, but there's a lot of people that feel that they don't have to. And that's problematic. So that's what we've seen on the Big Island. And I'm pretty sure that's what Mayor Victorino's seen on Maui as well.
Mayor?
That is true, Daryl. And I coined this phrase a long time when we started this whole pandemic, knuckleheads. And we have quite a number of those that really like to be anonymous and say these kinds of statements. And that's fine. I live with that. But the facts were there. Because even our Department of Health, across the board, we're seeing clusters from local events, local parties, local churches. And these are all coming out throughout the pandemic, returning people from other visitations to the mainland, we're bringing it in. And we saw it. But now we've been able to prove it with our secondary test. And really, the effectiveness of the vaccination program is really resonating. And I think Josh will agree. I have the actual facts because we've done it over the last 3.5 weeks. It's something current. We know we are now vaccinated 50%. Thank you. And so now this is really proving the point that vaccination of yourself will help protect you, your family, and your community.
Peter Ingram from Hawaiian Airlines. We got a question, and it's somewhere in this pile of questions here. I can't find it again. But it was a question along the lines of no, I can't remember the question since I don't have it in front of me. But basically, with the airlines, the vaccines and so on, are you folks doing much to? I know what the question was. Sorry, folks. I get lost sometimes. But I'm completely brain bubble. So travel insurance, right? I just had to book some travel, and it said, "You protect your flight with travel insurance." And in the old days, I would do that because if something happened and I had to pay a mint to change my flight, or I couldn't get a refund. But for a long time, all during this pandemic, people have been able to, if they can't get their test result, change something, or if the situation and the destination they're going to becomes risky, they can change their flights and so on. How close are we to the point where the airline industry will no longer be as flexible as that? Are we going to go back to the old times of literally buying a non-refundable ticket and eating it if you have to change your plans?
Well, some of the temporary adjustments that were put in place have been changed already in the early part of this year. But we've actually made some important changes at Hawaiian Airlines to make new programs permanent that actually add more flexibility to our guests. And I'd point out two. One for all of our tickets except for main cabin bases, we no longer charge any change fees at all. So change fees have been eliminated from our main cabin tickets, from our other tickets on our airplane, and the other changes are Hawaiian miles. We've now changed our program so that those don't expire, and I think some of this was inspired by really wanting to address some of the things that have frustrated people about travel in the past as we're coming out of this pandemic and people haven't been able to travel, and think about how we can make the experience better on a permanent basis going forward.
John DeFreitas from Panda Travel, I think that question that I couldn't find was originally for you, because they were asking, do we need to have, tour operators protecting us? Do you see that changing? Do you see that there's going to be more need to plan better so that you don't end up running into fees and so on, as opposed to this sort of free-for-all that we've had for a little while?
Well, I think domestically people are okay. I think once we open up internationally, especially until we have a firm feel for the virus and where it goes, if you're going to travel internationally, once the Asia or Europe opens up, I think you really need to have insurance. You just don't know. I mean, we always recommend the travel insurance even before COVID, just in case you got ill or something happened and you're stuck there for an extended period of time. So definitely the insurance does come into play.
Okay, thanks. Lieutenant Governor Green, a couple of questions for you, and maybe for the rest of you. This concept of herd immunity, which I have a hard time saying, I keep calling it herd immunity, but is it a real concept? This is a question, Dave from Kapolei. Is herd immunity realistically achievable? And another question, another Dave, or maybe the same Dave, is there really herd immunity? Seems like it's a carrot keeping changing. What do we know now about herd immunity? How close are we? And what's the impact if we reach it on travel?
Well, it does exist without a doubt. This is not a phantom. Medically, it exists. We will achieve herd immunity in Hawaii. Many states will not, but we will. When we get to 75% of immune status in our state, there will be so little virus that we will get protection for the rest of us, and people will have had exposure to antibodies and will be safer. We're very close now. Like I said earlier, over 50% of our population is now fully vaccinated as of today. 57% of our population, all the population, has had at least one shot. That means we're getting close. Plus, remember, we've confirmed 36,032 cases of COVID. That's another 3 to 4% of our population that have had COVID and therefore have natural immunity. And then a lot of my colleagues, my science colleagues, healthcare colleagues, say that we've had another at least 35,000 cases that never got tested. So that's another 3%. We will, in the beginning of July, see full herd immunity begin to rear its head, because we saw at 55% of vaccination status in Israel, for example, a relatively isolated country, their case counts plummeted. And you can see that effect already occurring here in Hawaii. Our case count average is 49, it was in the 80s not long ago at all. Our hospital numbers have dropped quite steeply. Our positivity rate is now under 1% for the first time in months, to 0.99%. So all of this is totally real. But the best part about it is, if you have been vaccinated, you have, believe me, herd immunity in your family, in your cohort. You guys are immune. And that is something that cannot be emphasized enough. I was speaking with General Hart right before our show tonight, and he wanted me to make sure, and I'm doing it right now, to encourage everyone to get vaccinated, because it's for the good of all. And there are still people that are vulnerable. People ask, why can't we get up there faster? Well, remember, we have 310,000 individuals that are 0 to 18 years old. Only a few of them started to get vaccinated, my daughter being one. we have 216,000 of our keiki that are 0 to 11 years old and will not be able to get vaccinated. So most of our adults have to get vaccinated or unfortunately catch COVID for us to get to a good immune state, but we're seeing it now.
Mayor Roth, this is slightly off topic of travel, but still relevant to this effort to get to herd immunity. You just requested, we were talking about this earlier tonight, a proposal where you would encourage people to get vaccines if they want to have a large group event. Can you please describe what that idea, what's happening with that idea, and how do you think it would work and what influence it would have on people's vaccination rates?
Well, actually, we heard the governor talk about it for travel just the other day. And we've heard Lieutenant Governor Green tonight talk a little bit about that. On Hawaii Island, we're looking at different ways of, making sure people do get vaccinated. One of the carrots is for indoor gatherings. We looked at raising our gatherings indoors to 25 people. But the way we're looking at doing that is saying, as long as more than 75% of the people in the gathering are vaccinated. We're looking at doing things like vax concerts, especially with our high schools, where we're looking at giving them tickets to a concert if they've been vaccinated, and only if they've been vaccinated. What everybody's been talking about is the more people we get vaccinated, the quicker we are going to get back to normalcy, the quicker we're going to be able to drop safe travels, the quicker we're going to be able to open our doors more fully. And so that's the idea, is not to punish people who aren't, but to reward people who do get vaccinated. Because, and Lieutenant Green just said it, we want to encourage people to get vaccinated, because it's for not just for them, but it's for everybody. It's for their families. It's for our community. It's all of our kuleana to get vaccinated. So that's what we're looking at.
Mayor Victorino, I understand that you might be looking at the same kind of thing. And is there a concern that the different counties are going to be doing different things again when it comes to incentives and vaccine triggers for tiers? Because I know that Kauai has been approved for reducing restrictions when the whole state gets to 70% vaccinated. Honolulu County is pushing to have lower restrictions when they get to 50% vaccinated. And Mayor Victorino, you also have your own program. How important is it that we kind of keep our act together here and not everybody go in a different direction?
I see Mitch has his hand up, so I'll give Mitch an opportunity if you don't mind.
Sure.
And let me just say, what we're trying to do as the mayor and the governor and at that senior level, we are looking at ways, especially in travel, that we're on the same page. We may have different rules in our counties as far as how many people can gather, but what the governor is talking about, what Josh is talking about, what General Hara, when we're looking at the future, this June 15th, hopefully that date, the idea is to be on a more uniform path. So, our tourists coming don't have to worry about, getting tested, if they're vaccinated. So we're trying to work on those things so we're more uniform for the travel purposes.
I understand. Mayor Victorino, you want to chip in on that?
Yeah, and exactly what I was going to answer is that we're looking at the travel aspect to having more uniformity across the board. As far as tier systems, I know Kauai now is tiers 5 and 6. I'm not seeing that being necessary. Maybe a tier 5 is what we're working on. Beyond that, I think normalcy can be achieved. And each county, based upon their numbers, their situation, the variants that are out there, it really makes, they have to make some decisions based upon what's happening with them. That wouldn't be travel so much as interior gatherings and parties and weddings and these different gatherings concerts, whatever. We have the MAC that's working on a program right now that follows very similar to what we're talking, being vaccinated and getting concert tickets and all of that. So all of us are working in the same realm. The percentages for our items may be a little different, but for travel, I do agree. We need to have a uniform number so not only the residents, but our visitors know exactly what they're undertaking.
Peter Ingram from Hawaiian Airlines, that must be music to your ears to a certain extent. But also, I'm wondering, given the benefits to travel, the travel industry, of getting as many people vaccinated as possible, I understand that you folks are actually getting involved with some of these incentive programs. Can you tell me a little bit about that?
Yeah, first of all, you're right. It is music to my ears to hear that we're coming to common ground on the testing protocols and the vaccine protocols, and I think we've shown that we can open safely, and we should continue to do that. So it'd be great to have more uniformity going forward. In terms of incentives, we have our focus is on our ohana, our employees, and we have encouraged them to get vaccinations, strongly encourage that. We work very closely with the Department of Health for all our Hawaii-based employees to get access to vaccines when people were eligible, and try to meter that out so that we went, first of all by frontline employees, and then working through those by age group. What we're looking at now is wanting to ensure that as high a proportion of our team is vaccinated as possible. And one of the things we've recently announced is an incentive program where people will, by showing us proof of their vaccination, we're going to reimburse any sick time, or if they didn't take any sick time when they got that vaccination, they will get some either paid days or extra vacation days. And we'll have incentives for people going forward to get the vaccine for people in each of our work groups. So we would love to get that percentage as absolutely high as possible. I suspect we won't get to 100%. But for us, it's also going to be important because we have pilots and flight attendants that fly to places like Australia and New Zealand, which have taken a very strict approach to the pandemic, and we suspect that anyone going down there may need to be vaccinated. So we're going to need to know as well if people are vaccinated before we assign them on trips where it may be a requirement.
Lieutenant Governor Green, this question just came up in our newsroom, and we did a couple of stories about it, and there was some confusion about it. Can employers ask about vaccination? I mean, we know they can give incentives, but I mean, isn't it in the best interest of an employer to know which employees are vaccinated, which not, particularly when the CDC says someone who's vaccinated can do this, and a person who's not vaccinated can't do that?
Well, it is in their interest to be able to share. And I think a good employee and a good employer really need to work together on this. There are obvious circumstances in which someone just doesn't believe in being vaccinated, and that's okay. I think we have to respect them, respect their wishes. However, I work in the healthcare field when I'm not acting as your lieutenant governor, and it really comes as a shock to me on occasion when I hear that one of my colleagues doesn't want to be vaccinated when they're going to be caring for patients and seeing people, face to face. And that can apply also to people in the travel industry and hospitality, where you would put someone at risk. And so I think we have to be all have to be very considerate of one another, because spreading cases to coworkers or people that come into our businesses has an immediate impact, and then also will have ramifications when they go home. So I think it's really prudent for people to openly share, because we can usually find a role for someone in the company or in the business that might not be as front-facing for a time. Soon we will have herd immunity. Soon we will be at 80% of all of our adults vaccinated. That's only a few weeks away. That means we're going to be utterly safe. Will there be a few cases? Yes. But will there be outbreaks? No. That's when all of these questions become moot. So I hope that people know that we've gone through something very extraordinary together. And I know we were talking earlier about who was causing cases to spread and this and that. We're not pointing fingers at anyone. Actually, all the people of Hawaii have done something special. We've kept our cases lowest among all the states in the country. This in spite of the fact that early in the pandemic, we could have very easily seeded our entire state with COVID because we had travelers still at the time from all over the world. So it's an extraordinary thing that people have done for the most part to keep major spread from occurring. Now I'm just asking here at the end, when we do have travel, when we are opening up, let's be considerate of one another so that we don't have any kind of last moment crises.
So in the meantime, there's a lot of people who are unhappy about one thing or another. So I have a big pile of sort of gripe cards here, and I'll go through because they deserve a right to be heard on our program. So Mike and Cindy from South Dakota have a comment. We spent $750 on COVID tests traveling to Kauai and Maui despite us already being vaccinated. We will never come here ever again. Another viewer, Francine from Maui, was frustrated with the lack of consistency of procedures between Honolulu and Maui when traveling back from Vegas. I'm not sure if she's talking about the second travel test, Mayor, but there are differences, right? Lieutenant Governor Green, when will you change the Safe Travel website to an app? I think it is an app, right? It's an app.
It has an app component to it. And I would comment, just keep in mind, everyone, I know some people feel that way. I will tell you the brand of Hawaii is stronger than ever, but one of the reasons that people are coming here in large numbers now is because we've been safer throughout the pandemic. And this will be remembered for quite some time. I feel positive that the 10% or so people that couldn't navigate the Safe Travels program effectively were heartsick about it. But on the other hand, the whole world saw that Hawaii was able to keep COVID under control in spite of the fact that we're so isolated. So I think this will have positive long-term effects on travelers.
I don't know who could bite on this one, but I got three different questions about the cards. I didn't get a vaccine card, just a typed piece of paper. Where do I get my card? Another one was, we have great partners with Kaiser's Queen and so on. This is Corky. Why can't the state make a more standardized and permanent or durable card? Make it easier for everybody. Once you're able to use a vaccine card, will you be able to use just that, or do you also need info from a smartphone? Lieutenant Governor, why don't you just briefly, the card thing, how is that going to evolve, do you think?
Well, the card is kind of the gold standard. So keep your cards. If you lose your card, the person or the provider that gave you your shots can get you a repeat or follow-up card, replacement card. We also do allow people to have that sheet if it's from the vaccine management system, the VAM system, to help show or demonstrate that they've been fully vaccinated. And we're working with a bunch of partners. You've heard stories about Clear and Common Pass and all these partners in the mainland, IBM and others. If they have an automated system, a tech and app system, we'll be able to use that too. But this will not really be a big issue once the COVID crisis has abated and or we've gotten to herd immunity. So I hope people won't perseverate on this problem. I hope that they will realize that this is a temporary thing. But there have been cards, vaccine cards around for a lifetime. Cards when you travel to Europe, cards when you had to get yellow fever shots, cards when you have to have your vaccine demonstrated for public school. So it's pretty common.
Okay, so this is not going to be a question, there's music to Peter's ears this time. Who and what government agencies are approving all these flights to Hawaii? We already have over-tourism, overcrowded beaches and traffic, many coastal areas. Is there a plan for how many flights to Hawaii and from where? Peter, that's not a fair question to you. Your job is to get people here and get people there. But for the mayors, I'm wondering, Mayor Roth, how much frustration are you seeing from your constituency, briefly, about 15 or 20 seconds, about just the tourists are coming? There were 100 times more tourists this month than there were a month ago last year.
You know, we've seen only a little bit, but I got to say this, Peter mentioned what they're doing at Hawaiian. The hospitality industry, Hawaiian and our hotels, they've been doing a really fantastic job of keeping COVID out of our islands, and they should really be applauded for the great work that the tourists, the hospitality sector has done to keep our islands safe and healthy.
Mayor Victorino, very quickly, I only have about 10 more seconds. How are your constituents responding to that number of tourists that are coming?
I think many of them, like myself, have been taken off guard because of the quick recovery. I mean, all the numbers indicate it will take us to 23, 24 before we get there. So it's been a difficult challenge balancing it all, but we're working at it, and I think soon we'll have some answers that will make people happy.
All of you gentlemen, you've done a great job. I actually have a question that I could answer because I had to do this. Jade from Honolulu. Are people able to travel from here to Canada? Are there any restrictions? Tons of restrictions. It's not even worth trying if you're not a resident. Even if you're a resident, a citizen of Canada, you have to stay in a hotel for 3 days. It's very, very difficult. I would not recommend trying to go to Canada for a while. Plus, their vaccination rate is very low. And mahalo to all of you for joining us tonight. And we thank our guests, Lieutenant Governor Josh Green, Maui County Mayor Mike Victorino, Hawaii County Mayor Mitch Roth, Peter Ingram, President and CEO of Hawaiian Airlines, and John DeFreitas, Product Development Manager for Panda Travel. Next week on Insights, we might still be in a pandemic, but that doesn't mean we're immune to other catastrophic events. So is the state ready for the next hurricane, flooding disaster, or volcanic eruption? We'll find out. Please join us then. I'm Daryl Huff for Insights on PBS Hawaii. Aloha.